Hello, thank you for the opportunity to present my study here at the SMCME Annual Research Forum. My study title is Peri-operative Antibiotic Use in Neonatal General Surgery, a survey of the American Pediatric Surgical Association membership. My name is Samuel Kweku Osei, General Surgery resident from William Beaumont Hospital, Royal Oak. I do not have any disclosures. Surgical site infections are a major source of perioperative complications. There is limited data regarding antibiotic prophylaxis in pediatrics, and unfortunately, there are no standardized guidelines regarding perioperative antibiotic use in neonates. Thus, perioperative antibiotic use is mainly based on the surgeon's experience and his or her preference. The objective of this study is to describe the practice patterns of pediatric surgeons with regard to antibiotic prophylaxis for surgical site infections in neonatal surgery. So we did survey members of American Pediatric Surgical Association. The members were asked to respond to 6 hypothetical case scenarios. Our questions focused on antibiotic initiation timing, the type of antibiotics used, and the duration of the antibiotic therapy. We used these 6 clinical scenarios to gather member responses. The responses were analyzed using chi-square with pairwise comparisons. Our survey had 156 responses. The majority of the respondents practiced in academic or academic-affiliated centers and were a median of 12 years out in practice. Initiation of antibiotics prior to surgery varied between respondents and case scenarios. Most would not initiate antibiotics prior to congenital diaphragmatic hernia repair. Most respondents stated they would initiate antibiotics prior to surgery for intestinal obstruction from malrotation with volvulus. However, only about 60% would initiate antibiotics prior to surgery for intestinal atresia and esophageal atresia. Similarly, there was not overwhelming consensus on whether or not to start antibiotics on Hirschsprung's disease, as 43% stated they would initiate antibiotics at the time of diagnosis, whereas 57% of the respondents stated they would not initiate antibiotics. Across all case scenarios, of the respondents that stated they would start antibiotics prior to surgery, most of them stated they would start antibiotics within 1 hour of incision. Cephalosporin was the most common preoperative antibiotic chosen. However, depending on the case scenario, some respondents also favored 2-drug combination and single broad-spectrum antibiotics. There was significant variation in post-operative antibiotic treatment responses. For example, in intestinal obstruction scenario, half of the respondents stated they would continue antibiotics post-operatively, and half of the respondents stated they would not. But in the esophageal atresia and Hirschsprung's disease, about 60% of the respondents stated they would continue antibiotics post-operatively, and 40% stated they would not. In gastroschisis, most would initiate antibiotics at the time of silo placement and stated they will continue until definitive closure. However, when they were asked on what type of antibiotics they would give, there was no consensus on the type of antibiotics they would administer. Our study is limited as the responses are based on hypothetical cases that limits the generalizability of the study. Furthermore, we did have low response rate as we had 12.3 response rate. In summary, we saw the most consensus with congenital diaphragmatic hernia repair and intestinal obstruction from malrotation with volvulus. For those who would give antibiotics prior to surgery, Most stated they will start antibiotics within 1 hour of surgery, and cephalosporin was the antibiotic drug of choice. We saw significant variations in responses with esophageal atresia, intestinal atresia, and Hirschsprung's disease. In conclusion, there exists variability within pediatric surgical community regarding perioperative antibiotic use in neonates. Our survey study highlights an opportunity to create guidelines and help standardize perioperative antibiotic use in neonates. However, to do this, robust data about surgical site infections and perioperative antibiotic use in neonates is needed to help develop such guidelines.